Welcome to Ayurveda and Spirituality with your host, Alakananda Ma, a renowned Ayurvedic expert and a graduate of a top London medical school. She is the principal of Alundi Ayurveda Gurukula, a unique apprenticeship-style school in Boulder, Colorado. She is a spiritual mother, teacher, flower essence maker, and storyteller. Join us as we uncover the timeless principles of Ayurveda, discover practical tips for enhancing vitality, and explore the deeper dimensions of spirituality that intertwine with the ancient science of life.
Hello, everyone. Namaste. Welcome to the subject of Ayurveda for Parkinson's. If you're listening to this podcast, maybe you have yourself received a diagnosis of Parkinson's. Maybe you're married to someone who has. Maybe you have a relative who has, or a friend or family member. Unfortunately, that is so likely because of how common Parkinson's disease is. It's the second most common neurodegenerative condition, second only to Alzheimer's. There are 500,000 Americans who have a confirmed diagnosis of Parkinson's, but there are so many who go undiagnosed, so the number's probably a lot higher. And unfortunately, it's going to get higher. A little bit of history. There was a huge increase in Parkinson's disease due to the 1918 flu, the so-called Spanish flu, which killed as many people as World War I itself. The people born during the Spanish flu era had a 2 to 3-fold increased risk of getting Parkinson's compared to those born earlier, those born before 1888, or those who were born after 1924. That's the history. Now for the bad news. We're going to get a huge increase in Parkinson's due to COVID, and that is more than probable. This has even come in Fortune magazine earlier this year. And unfortunately, since almost all of us have been infected with COVID, almost all of us are at greater risk for Parkinson's disease. So there was a study that was published in the journal Cell looking at how effectively the SARS-CoV-2 virus, the virus that causes COVID-19, could infect different types of cells. It especially likes to infect neurons, brain cells, and most of all, it particularly likes to infect dopamine-producing cells. You can kind of figure that out and guess that already due to the fact that actual loss of the sense of smell has been a remarkable symptom of COVID-19. Not like when you have a cold and you get a stuffy nose and you can't smell properly and you can't taste properly. This is completely different. This is at the brain level, the actual loss of your brain's ability to perceive those signals about smells. My nephew reported not being able to detect when the baby needed a nappy change. That's how bad it can get. So we'd better make sure we know about Parkinson's, how best to prevent it, how best to stave it off, how best to work with it should we get it. What is Parkinson's disease? It's a progressive degenerative disorder. And what it's affecting are nerve cells deep in the brain, the basal ganglia, which control a lot of our involuntary movements, and the substantia nigra. The substantia nigra produce dopamine. Most of us have heard of the neurotransmitter dopamine, and they relay messages that plan and control body movement. Things like swinging our arms when we walk, having a nice gait when we walk. So, in the situation of Parkinson's disease, there starts to be a die off of those dopamine producing cells in the substantia nigra. Substantia nigra means the dark or black place. And a lot of the dopamine has to be lost before we actually get the symptoms, the typical symptoms: tremor, uh, slow movement, stiffness, and balance problems. And a little more on the connection between Parkinson's and COVID. Loss of smell, independent of having COVID, has for long been known to be an early warning symptom of Parkinson's. The loss of smell can begin long before any other symptoms do start. In Ayurveda, we call Parkinson's Kampavata, tremor disease, and it is part of a big basket of diseases that are known as Vata Vyadi, a collection of very special Vata-related diseases, many of which are neurological. So when it comes to Parkinson's and Ayurveda, let's just say that we don't claim or really aim to cure. Let's see if we can slow the progression. Let's also see if there are some windows into improving the prognosis. In Ayurveda, we work with three things: diet, lifestyle, and herbs. So let's think first about ahara or diet. We just said that Parkinson's is part of Vata Vyadi, a big basket of some very complex diseases, neurological conditions that are rooted in Vata. So it'll be really helpful to think about a Vata pacifying diet that's building and nourishing. That means having foods that are soft, soupy, moist, well cooked, sufficiently oily, and serving them warm. And we think about having combinations of foods cooked together, like khichdi and soups and stews, really great. You can go to our website, alandiashram.org, click on the recipes button at the bottom and get so many great recipes for khichdi's, dals, and soups that'll help you. Caveat, yes, for the disease, you need a vata soothing diet. But suppose, as I have quite a big cohort, I'm afraid, of Parkinson's patients, and I do have some that are former footballers and are pretty big kapha guys with pretty big bodies. So that individual ideally would be having a kapha soothing diet, and the tastes for vata and kapha are opposite to each other. The textures for vata and kapha are completely opposite to each other. So what are we going to do? A couple of things. First of all, to learn more about nutrition, if you or your loved one is dealing with Parkinson's, we do have an Ayurvedic nutrition course that you can take that'll help you to understand how to work with diet for yourself. Secondly, an Ayurvedic practitioner or an Ayurvedic doctor will be able to help you to work out a diet that would particularly be good for you. Okay. Um, if we are thinking vata soothing, we might want small, frequent meals. If you find you're not able to digest a big meal, we'll tend to go for a little smaller and more frequent. We often go with two meals and two substantial snacks for vata. Again, your cover footballer who got Parkinson's due to head injuries, that's not going to wash. You're going to need a two-meal plan. So let's think about it carefully. Make sure you stay hydrated. Now, there is one window of possibly being able to do more than slow the progression of Parkinson's. And we can work with that particular window, especially through diet and spices, as well as through our herbs. This window is that Parkinson's, as any neurodegenerative disease, has to do with what we call oxidative stress. I use the analogy rust, where if you don't have good auto body paint on your car and it gets wet, it's going to rust, and that is due to oxidation. You don't get actual rust in your brain, but your brain is going to sort of rust in the sense that it's going to degenerate due to what we call reactive oxygen species. Oxygen is the stuff of life, but you need the right amount of oxygen in the right form, in the right place, and otherwise it's going to cause brain rust, and that's going to be a problem. But it gives us a wonderful window because we can think about the potential of shutting off the progression of Parkinson's with antioxidants. So we want to have a diet that's rich in antioxidants, such as glutathione, which is being studied now for possible effectiveness in Parkinson's. But also my general rule, eat a rainbow and get all kinds of antioxidants. Some of the foods that are rich in glutathione do include your cruciferous vegetables like cabbage and broccoli and kale. Also includes onions and garlic. We love tomatoes. They're a good antioxidant food. Avocados, squash, fruits like strawberries and peaches, asparagus, yum. So you can have a very yummy diet, eating a rainbow, having all kinds of colorful fruits. So first of all, get onto your basic healthy diet. Your basic healthy diet is getting off of bagged snacks and junk food and lunch meat and deli meats and getting onto basically whole grains, colorful vegetables, fruits, plenty of legumes. Beans are an absolute gold mine of antioxidants, beans and lentils. So the first step is getting on the basic healthy diet, weaning yourself off of McDonald's. Am I going to get sued for saying that? Weaning yourself off of Big Macs and all that stuff, bagged snacks, getting on to eating foods that come from the ground rather than from a factory. And then moving towards an Ayurvedic diet where we're eating for our prakriti, our constitution, like we just gave the example of the footballer who got Parkinson's from head injuries, and vikriti, your current imbalance. And if that's a complex situation, an Ayurvedic practitioner is going to help you with that. So diet could be a magic key to improving your outcomes. Next, we want to think about Vihara or lifestyle. Since Parkinson's is a Vata Vyadhi, a Vata caused disease, we really want to make sure that there's a good daily routine, some kind of regularity. Sometimes I like to have, for me, I find a weekly routine is helpful alongside a daily routine because I can't fit everything I want to do for myself into one day, but I can do some of the things 2 or 3 times a week by fitting them into certain days of the week. But some good routines, yoga asanas can help you. Gentle asanas, supported bolsters and so on. Dr. Ladd's favorite series: cat, cow, camel, cobra, bow, boat, and bridge is a very good, simple series for relaxing your muscles. Also, it can be very helpful to have a meditation practice. Aside from anything else, if we get a good enough meditation practice, we'll be able to have some kind of equanimity, some kind of cool, even if our disease is progressing. Dr. Ladd also has always liked to recommend the Soham meditation. This is the first thing that Dr. Ladd taught me, Soham. It's called the Ajapa Japa, the mantra that is not even needing to be recited, because your in-breath always makes the sound so, and your out-breath always makes the sound hum, and that is always going on, whether you are paying attention to it or not. So you can just pay some attention to your breath, noticing or saying in your mind, so with your in-breath, and hum with your out-breath. Chanting and mantras can also be good. Om is always wonderful. All you need is Om. All you need is Om. All you need is Om. Om. Om is all you need. But also, Divine Mother's favorite mantra, Hreem. That's a great one too. Making sure you do have an exercise routine, and that can be difficult to do when it's hard to get up from your chair, if you're moving slowly, if your feet are shuffling, or if you're feeling unsteady. Honestly, if you're feeling unsteady, just go ahead and get yourself a nice looking walking stick, one you can be proud to have, help you not to fall over. Balance does get affected by Parkinson's, but we've got to keep moving. It's really important. Things like going for walks, enjoyable walks, going swimming if that's available. Gardening, that's one of my favorite ones. Look, I'm Pitta. I like exercise that's also accomplishing something at the same time, and I enjoy it. So that's 3 pluses for gardening, weeding, digging. Love it. Dancing. Can you do any dancing? Stretching. That's all going to be really good. That's going to go for the gross motor skills, the aerobics. That exercise is another way to prevent that oxidative stress, that brain rust, and bring a good blood supply to the brain. But sometimes when one has Parkinson's, we can see an effect on the fine motor skills, and even the handwriting can get teeny tiny. So make sure you write. We're coming into an age where writing is almost passé, and the younger people may not know how to write cursive, but if you've got Parkinson's, That means you're probably in an age cohort that did learn cursive in school. Try to write. You could write a few affirmations. I am loved. I am safe. I am happy. You could write some loving kindness. May you be safe. May you be happy. May you be healthy. May you have ease of well-being. You could do some Likha Japa. You could write some pages of Ram, 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 Ram if you know how to do that stuff. That's always a fun thing. I like to do Likha Japa a little bit. Um, as you can get to where you can write more, see if you can do a bit of journaling. I think journaling is absolutely wonderful. I love it. Doing a gratitude journal. At different times in my life, I've done a gratitude journal and even something I called a journal of delights, which is kind of like a gratitude journal, but it gets me away from the kvetch journal, which can happen too, can be quite necessary. But reading back at the kvetch journal can be a little annoying, whereas a journal of delights uh, helps us to have that positive attitude. I went out in the garden this morning. There were two woodpeckers, one on the beanpole tripods, one on a stem of a giant sunflower. There was a whole flock of goldfinches and many other birds that I didn't even know how to identify. And it was so magical. That was one of my delights for today. So trying to write a journal of delight, seeing if you can write letters to the ones you love. The more we write rather than type, the more we'll keep up our fine motor skills. Another thing that I like to do personally, in my case, not for Parkinson's, but for hand arthritis, I like squeezing a hand strengthener. I was given a hand strengthener that is a little green brain. So if I get annoyed, I can say, if the student is falling asleep in class, I can say, I'll throw my brain at you. I if I'm sitting listening to a student's presentation, actually squeezing the brain, the hand strengthener, does help me to pay attention also, stay engaged. So you can be squeezing a hand strengthener during other activities like watching TV or listening to the news or any activities that don't involve your hands. Another part of vihara or lifestyle, it can we can get a low mood in relation to Parkinson's, or we can get a low mood because of how stressful it is. We want to cultivate a sunny mood, and we do that with sunbathing. In Ayurveda, we call that atapa seva, sun worship. It's really good for our mood. Ideally, we want to get 20 minutes of sunlight on our skin. Don't look directly at the sun, but just to get out in the sun. I know it's been summer and it's been hot and we've been trying to stay out of the sun, and now we're at the point. It's October, the nights are longer than the days, and now is when we have to start making an effort to get out in the sun and get daylight. Outdoor morning exercises, sun salutations out of doors if you're able to do that. So that's diet and lifestyle. Those things are in your hands, but an Ayurvedic doctor can help you make a plan that is really tailored to you. Now let's talk about the third pillar of Ayurvedic treatment, Aushadhya, herbs. So I'd like to make a few important points. First of all, I feel that your very best time to bring in your herbs are at the early stage of Parkinson's when you haven't yet been told by a neurologist that you need to take the levodopa or the levodopa carbidopa. The next thing I want to say, listen carefully, this is very important. It is not about going out and buying a Mucuna pruriens supplement. Taking a Mucuna pruriens supplement falls in the category, number one, of using herbs as drugs, and number two, using herbs as drugs that are not as quality controlled as actual drugs. So if your neurologist is giving you levodopa or levodopa carbidopa and you're taking Mucuna pruriens, it might be bad for your treatment protocol. Okay, it might be unhelpful. When we just take a Mucuna pruriens supplement, we're getting a big dose of levodopa in the Mucuna, but we don't know how big of a dose. And we're just using a herb as a drug. What is an Ayurvedic doctor going to do for you? At least in the case of myself, I know what I would do. We make a balanced formula. Because we make a balanced formula with 7 to 10 herbs combined together with amazing synergistic effects, we don't need to use very much of any one herb. So when I'm putting kapikachu in your formula, kapikachu is the Sanskrit word for Mucuna pruriens. When I'm putting kapikachu in your formula, you're getting such a small dose. How is it working? Because it's going to be 30 times as effective because I'm putting in a friend called Gokshura, which is kind of like your carbidopa to your levodopa. It's helping your dopamine to your levodopa to stick around for longer. It's helping there to be more dopamine at the synapses. And I'm going to have a bunch of other herbs that are antioxidant, that are nervine, that are good for other conditions you might have, like heart problems. They're all going to work synergistically so that that tiny amount of any one herb is going to be 30 times as effective, but with a lesser likelihood of side effects. So that's why you really want to get a properly balanced yoga or formula, yoga in this case meaning formula, from an Ayurvedic doctor. Another thing is in Ayurveda, we have to think about herbal energetics. Mucuna pruriens is a hot herb. It's not good for you year round, and it's not good for all body types. If your pitta is provoked, you got to be cautious with it. So again, when I'm giving it to you in a formula, it's going to be all balanced out, and the formula is going to be heating, neutral, or cooling, depending what you need at that time and at that season. Whereas just taking a very hot herb, probably a large amount year round, whatever that is, it's not Ayurveda. A herb growing in India doesn't make it Ayurveda. A herb being used in a balanced formula, taking into account your constitution, your vikriti, your current imbalance, the season, where you live, many other factors. That's what makes a herb Ayurvedic, the way it's used. And we will also be giving you a specific way to take the herb, like with a tea, or with honey, or with hot water, or with aloe vera, or a different, what we say, onupan, a different vehicle to take the herb with that'll make it work better for you. Another thing that to me is very important about how I like to work with Parkinson's is using two routes of administration. part of this has to do with the problem that your symptoms can flare up in between doses. So that's why we want to have two routes of administration, quick acting and long acting. Quick acting is nasya, means nose drops. Personally, I've made special nose drops for my Parkinson's patients. And how that came about is, first of all, I made special nose drops for all the people that lost their sense of smell during COVID. It hasn't done that much as I would have liked to see for the people that lost their sense of smell during COVID, but it's been absolutely brilliant for COVID brain fog. And just my feeling that I am doing something to prevent you getting Parkinson's from COVID in the first place by getting antiviral and dopamine supportive herbs to your brain. Um, so, so that's how then I found that I wanted to use something similar for my Parkinson's patients that hadn't had COVID. So I didn't need to have the antivirals in it, but I did need to have the brain support and the dopamine support. So how the nose drops work is the nose is the gateway to the brain. Those oily drops that go into your nose, they're going to be taken up by the blood vessels of the nasal mucosa. Those blood vessels are joined up to across what's called the cribriform plate of the ethmoid bone, so a little tiny sieve-like sinus bony thing that gets to the backside, the brain side. Once it gets to the brain side, it's going to get to what's called the circle of Willis. The circle of Willis is the ring road around your brain. Uh, it's a ring road. I know London has a ring road. I don't know about other big cities. It's like the ring road that goes around your brain, the big blood vessel. There's blood vessels that branch off it that go to the different suburbs and metropolitan areas of your brain. So now it's in that ring road close to your brain, and anything that's a nervine is going to be actively transported across the blood-brain barrier. The brain's going to say, give me that. I want that. And it's going to get taken up. So that's going to be a very rapid way of nourishing your brain. And then your formula, which you're taking with honey or hot water or Dashamula tea or whatever we have you take it with, your formula is going to be more long acting because it has to go through your digestive tract and get digested and absorbed and then get into your bloodstream and thereby get into the circle of Willis and to your brain and get taken up. So now we've got two waves of action, a shorter action and a longer action. So that's going to sustain you better. I do understand there can be barriers to doing nose drops if you have a hand tremor. If you have a loved one in your life who shares your home with you, maybe they can help you to do your nose drops. But really try to do the nose drops for all the above mentioned reasons. And if you have had COVID, it's going to be a little bit different kind of nose drops because we're going to want to deal with viral persistence, those viruses that if they keep lingering in your brain, you could end up with Parkinson's or indeed dementia. Okay, so Parkinson's, Kampa comes in the big basket of Vata Vyadi or Vata type diseases, a degenerative progressive disorder. It's affecting the dopamine producing cells that are regulating types of movement, like swinging your arms when you walk, affecting your ability to be natural. We're going to deal with it with diet, which can be a great window into potentially shutting off the disease process. Diet, lifestyle, especially some great exercise, and herbs. There you go. Namaste. Sugandhim pushtivadano